Hello, everyone.
Hello. Can you, in a second, can you hear me okay, Kyle?
Yeah, sorry, I'm just having issues with my headphones. There's sounds not coming out of the right spot. Not, I can hear you though. Sorry, I'm just having issues. There we go. I think I got it fixed. You guys can hear me?
We can hear you. You can hear us. Doug, you can hear us okay?
I can hear, yeah, and see, folks, for sure. It's good to see everybody, or some folks who are there as opposed to yeah.
It wasn't available. We have 5 minutes after the meeting, after we close the meeting, just to quickly chat about Canada Day. Just quickly. Okay. And, well, we want to find out some political sensitivities. Kyle, after we're done, after we close off, we stop recording, we close the meeting, you okay to hang out for a couple minutes with us, chat about Canada Day?
Councillor Andrews, you got your mic muted.
Yeah, it was muted.
Did you hear me, Kyle?
No, I must have lost you for a second. Sorry.
I was just saying, after we're done the meeting, after we adjourn the meeting, close off and stop the recording, are you able to hang out for a couple seconds there, and we'll, that's one of us we can chat about Canada Day.
Yeah, I got time for sure.
Okay.
Very well. I'll call this special regional council meeting to order. Please be advised that today's meeting is available for the public to attend virtually and is being streamed and recorded. Can I get a motion, please, to adopt the agenda?
So moved.
Moved by Councillor Roper, seconded by Councillor Penny. All those in favor?
In favor.
Carried. Doug Blackie, Regional Health Advocate, Progress Update. Mr. Blackie.
Great, thank you, Your Worship, and hello, Council. Happy to provide an update on the Regional Health Advocacy project. And what I would like or request is, would I be able to have screen sharing, please? I just have a couple of quick slides that I wanted to share with Regional Council this afternoon.
Absolutely.
There we go. All right. So I would like to report that the review appears to be mostly on track. You should be able to see our standby one here. Single page. There you go. You should be able to see the proposed project plan. This was in the original RFP, and we've updated it to provide you today with a little bit of more information about the project and where we're at. We're running probably about a week to a week and a half behind schedule. This is not unusual given that we had some challenges with scheduling some of our consultations and those sorts of things. But we're hopeful that we'll be catching up, fairly soon with everything regarding the project. So we're in that sort of development of and I'll talk about it in a moment, developing the advocacy strategy and the implementation plan. So that should wrap up by the end of this month, which is about a week behind schedule. And then really spending the summer months and into the fall implementing the strategy with you, as well as taking some time to review it, refocus it if necessary, re-engaging with stakeholders and partners through the process. So it's sort of heads down work right at the moment, as we call it, over the next month to get a draft strategy and implementation design put together. And that draft we'll be reviewing with some of the core folks that we're working with at the Northern Rockies Regional Municipality, and of course Council. You'll have an opportunity to provide feedback as well on the direction of the strategy and the approach that we're using, which is informed by the consultations, which are now wrapped up. We've talked to about 24 local, regional, and a handful of provincial folks, as you know, to help us really understand the current state and perhaps the preferred vision of health services in the Northern Rockies. So I'm just going to stop the share here. As you know, we talked to those folks that, your colleagues around the table, of course, as well as community and health and social agency representatives. And as I mentioned, people from BC Emergency Health Services, the Doctors of BC and Northern Health. Several themes, as you know, we had about 126 different comments that we then qualitatively analyzed to come up with a number of themes. And those themes, in a good way, have echoed the community health plan that was developed a couple of years ago. So those themes being around the regionalization of services, transportation for people in the Northern Rockies to access those services, a clear desire to try and repatriate some services back to the Northern Rockies, and the use of virtual care. We also heard, as you know, a lot of pluses. We heard some positive comments about primary care and how very fortunate you are to have and still have 5 physicians in the community, that the hospital staff were friendly and helpful and a real benefit to the community. And what I heard almost to a person was an intense love of place and community spirit. And I've talked about these before, and a real passion about healthcare services, and growing not only what is available in Fort Nelson and the Northern Rockies, as well as improving those services and improving health outcomes as the population continues to be fairly dynamic. We had a workshop on May the 20th, and I'll just quickly share this slide with you. Just hang on one sec. We had a workshop on May the 20th that reviewed the themes that had emerged from the work. And sorry, there's no expectation you need to read these. It's really just to give you a sense of the different ideas and the number of ideas that we had. And we asked people in the workshop, we had about a dozen or so, pretty good cross-section, regional council, Fort Nelson First Nation, as well as community groups and Northern Health. And we had a good conversation, I think, about the themes, about the issues that have been identified in the consultations. And then we did an exercise called 15% Solutions, which was really focused around what is it within our power, a small step that we can start right away that may take us a little closer to those larger goals around transport and maternity and diagnostic imaging and those sorts of things. So the 15% Solutions came up with about 3 suggestions per person. We've gone through a subsequent process now of kind of filtering those and reviewing them and creating some other themes. But what they do is they help me and help us develop a bit of an action plan. So what are some things that we can start doing right away? So while transport is out there as a priority, what can we do in terms of some small steps? And we can use this process and combine it with some of the steps that were identified in the community health plan as well to try and then create our implementation strategy. And some of the ideas that came up were, developing some innovative ways to recruit and retain healthcare professionals in the Northern Rockies, really leveraging technology. And this is one in the past year that there's been a real shift, as you know, in the application of virtual care around the province and in the Northern Rockies and across the north because of the pandemic. And what it means is that we've kind of almost as healthcare professionals, but also consultants, but more importantly as people, as patients, as citizens, begun to really see and experience virtual care. And so I think there's some really great opportunities for the Northern Rockies to continue to really double down in its advocacy around virtual care, both its strengths and its weaknesses. But I think what we've been able to demonstrate in the last 14 months is how effective it can be for certain things that may then preclude a trip to Prince George or Fort St. John or Dawson Creek. And we also want to look at ways to strengthen travel. And I think there's travel support for citizens. And I think there are some ideas as well that came out in our 15% solutions work. So where now? Well, we've been going through a bit of a process, as you know. When we originally laid out the RFP, we talked about getting out with the community, talking to people, really trying to understand what the issues are, how they've evolved since the community health plan was developed, and are there any new things that have emerged or new priorities. So we've been going through that process, as you know, and several of you have been involved in that. And I just wanted to share one last slide here, which is really kind of our process, which has followed a framework that really asks what, so what, and now what. And the what is really about discovery. It's saying, okay, what is it that we know? What is it we don't know? What is it that I don't know that you may know, and vice versa? And where are the opportunities? So we've been doing the consultation. We've been reviewing, the state of the community report, as you know. The public survey was done a couple of years ago, of course, the community health plan. We're also looking at some broader sort of socioeconomic data. We were talking about this a couple of days ago around the population in the Northern Rockies and how it's fluctuated with the oil and gas sector changes, and how does that impact in terms of the Northern Rockies, in terms of healthcare and healthcare planning and those sorts of things. And we've been really trying to, curate, which is a bit of a buzzword these days, but really organize a lot of our discovery from talking to people, from doing our research, to really say, okay, what's the picture look like for the Northern Rockies? So we're analyzing the findings. We're kind of in that so what mode right now. We're saying, okay, so what have we learned and what does it mean? We're developing those initial themes. We're validating them. So we went through the workshop, identifying some of those priorities and 15% solutions, and then figuring out what our next steps at. And that's where we are now, is in this now what. So I'm in the midst of drafting the health advocacy strategy. It's coming together actually fairly well, I think, and we should have a workable draft by the end of the week that I'd be happy to share. And baked into that is an implementation plan, or will be an implementation plan. Part of that is understanding who should we be talking to, when we should be talking to them, are there opportunities to talk to them? And that's the feedback that I'm going to want from not only the elected officials at council, but city or municipal staff as well, just to say, are there some forums that are coming up? The big one being UBCM, but are there other forums, other meetings that are coming up where we can start to, focus some of the key messages and priorities into those meetings, as well as any new engagements and who would we be talking to and those sorts of things. And then, as I mentioned off the top, it's around implementing that strategy, but also using a learning model to say, okay, after a couple of months, how are we doing? Have we achieved anything? Have we changed the tone of the conversation? Is there a different conversation that's occurring? Has something else emerged? And he's sort of evaluating and rejigging the strategy as we go along in a bit of a learning cycle. So that's the work that we're in the midst of in terms of writing the strategy and the implementation plan, identifying some of those key stakeholders and targets and allies. And I like to use that word allies because it's about building coalitions. It's about finding partners and like-minded organizations and individuals out there who can help advance the message for the Northern Rockies. And yeah, as well as metrics, how will we know we're going to be successful? And I'm going to try and come up with some draft ones, but I'd be very open to your feedback as well about what does success look like you know, in a practical sense, but also in terms of a longer term vision. So that's our update. I have provided a tracking document late last week to Jaylene, which I believe is in your package, which lets you know that, you know, there's some certain parts of the project that are now more or less completed, and everything else appears to be on track. As I said, we're about a week out of whack, but we should be able to catch that up fairly soon. And yeah, I'm open to any questions that people have. You know, just a reminder that you know, our current engagement works out to about a day a week. So these things, you know, part of me wants to do them quicker, but the reality is that, you know, we have a set amount of hours to be able to give to the Northern Rockies Regional Municipality each week. It waxes and wanes a tiny bit. Lately, it's been waxing a lot, not waning terribly, but it's an interesting project, and it is moving along, which is good. So open to any questions, comments, Your Worship, that anyone has around the table.
Councillor Roper.
Yeah, just a fun question. Has there been any information or anything you've come across that has genuinely surprised you? Anything at all?
You know, that's a great question, Councillor Roper, and I think part of, and I've, you know, this is one of those sort of aha moments is for me as well. A lot of it has to be about validating the work that's already been done. So there's a huge amount of work that's been done, and part of our consultation was to say, you know, is it still valid? So a lot of it, in terms of a surprise, was good. A lot of what the work that was done in the last 2-3 years is validated. It's still valid, but some of it's been more nuanced. I think the things that have surprised me, to be honest, is in my conversations with some of the key people at Northern Health, the BC Emergency Health Services. I've got a meeting coming up in the next week or so with the Provincial Health Services Authority around just their planning and thinking about virtual care, is the willingness of these provincial and regional partners to say, yeah, you know what, the Northern Rockies must be serious about what they're doing, and to some extent, you know, and how can we help? And so I'm hearing a little bit of almost, you know, some flexibility that seems to be coming into the language I'm hearing. So it's not, no, this shall never happen. It's, let's talk about it. Let's look at the Northern Rockies as unique in terms of its geography, its economy, you know, those sorts of things. And maybe those are messages you've heard in the past, but what I found was there was a conciliatory tone when I talked to ambulance, when I talked to Northern Health, that I think may give us a window or a bit of leverage with them. Sorry, the one other thing, sorry, is virtual care. And that's one that I think in the community health plan, I mean, people have always talked about, you know, telehealth and those sorts of things. But what has come out in 15% solutions work, but also in our consultations, has been a real acceptance that we can deliver healthcare on Zoom, either at a regional level, a local level, but also exploring some of those opportunities to deliver primary care and hospital care using virtual. And there's already been some really great examples of how the real-time virtual support project has been able to support the local GPs, family physicians, in the hospital with complex cases, where they've been able to talk in real time with a specialist, you know, in Prince George or Vancouver, who can help them through and help diagnose very difficult cases. So it's that real normalization almost of Zoom and video technology and sort of technology leveraged care that I think is going to really start benefiting communities like the Northern Rockies. Even in terms of, we were talking about this on Friday at the Community Health Plan Steering Committee meeting around internet connectivity, and how there's been improvements, I believe, at the Municipal Hall. NH is hoping to get things upgraded. The advent of Starlink, Northern Health is prototyping some Starlink downloads, which is the thing that Elon Musk has started, which I think is going to open up a lot of technology-assisted life, for good or ill, throughout rural and remote northern communities.
Thank you. Are there any other questions for Mr. Blackie at this point? Okay, Mr. Blackie, I listening to what you've been saying about, you know, your approach, I really like this approach of looking at things that we can do and finding a way that we measure our progress. And some of these things may actually happen, you know, without our intervention at all. The uptake of telehealth now because of COVID-19 and some of those advancements, you know, may go ahead, you know, with or without us. But I think it's good that we measure some of the activities that we do and look for the benefits that come out of that. And one of them, of course, is in the recruitment field. Another one is in transportation of people into and out of the Northern Rockies. I think those are important things about how people access healthcare at a higher level outside of the community. I guess one other thing is I had a conversation with a lady who had some interactions with the health here, and I asked her if she would mind speaking to you about her experiences with healthcare in Northern Rockies, and she said she would, so I will share her number and her contact information, and I thought it was quite good. She had some experiences that I thought were worth sharing, so I'll pass on her information to you a little later. I have nothing further.
If I could just respond, Mayor Foster, I think that's brilliant. Thank you very much, because it has been one aspect of our consultation. It's been mostly, you know, working with kind of your known sort of community stakeholders and regional council to develop kind of and validate our approach. What we haven't done is a public outreach, and it is something that council may wish to consider in some way, whether it's potentially a town hall, a survey or something, you know, an update of the regional health survey, something like that, to ensure that you have citizen voice. But I'm more than happy to talk to this individual about their experience.
Okay, thank you. Any other questions for Mr. Blackie here? Very well. Did you want to continue then?
Well, with respect, that's all I had in terms of an update for council. I just wanted to give you a sense of what we've done and what we're doing, and where it should all come together in the next 4 weeks. And so we will be reaching out in a couple of weeks, you know, via Jaylene, to council to get some, you know, your views and feedback on our approach and proposed strategy for the advocacy work. And yeah, and as I said, right now it's a bit of a heads down, you know, typing away and working on pulling together all the information and making sure that, you know, what we're proposing makes sense and reflects back to you and to the community and your community partners, you know, what I've heard. And as I noted, a lot of it has validated perhaps what you've already known, which is great, because again, there aren't any of those sort of, you know, free radical crazy ideas out there. I mean, they are very fundamental ideas, very fundamental suggestions. And I think what we can do is, you know, we can build on the past and create I think a really robust strategy going forward.
One of the things that I find is, you know, some of the things that you think may be fairly simple within healthcare are not simple at all. And sometimes you're knocking on the wrong door trying to achieve something that's not achievable. And I, for myself, I would rather not waste efforts on things that are not achievable and look more for the lower hanging fruit, the things that we can work towards that will improve healthcare in the Northern Rockies, without getting too carried away in wasting our time and energy pursuing things that are not going to happen. But I think, you know, some of those issues that have been identified by the steering committee and by others in the community, I think are achievable. You know, like imaging, and what are we going to do with people who say they don't have a driver's license and they have to get to a doctor's appointment in Dawson Creek? What is the bottom line solution, and how is this going to be delivered to patients to get the desired outcome that they can get from here to there and back again, you know, for people who don't have sufficient income or ability to drive themselves or whatever. And so I think, you know, those sorts of nuts and bolts things down at the bottom and how we achieve that, I think, are going to be extremely important. And, you know, is this something we go to Northern Health about? Is this Emergency Health Services? Is this the Ministry of Health? Is that where we need to start working on some of these issues? So I think where we need to apply pressure and what we need to apply pressure on to achieve some of the achievable goals, I think is very important.
Yeah. And I take your point that there may be some, there's a number of initiatives that are going to be coming to the Northern Rockies over the next 6 to 12 months that, yeah, I mean, it could very well be the result of years of advocacy by the Northern Rockies. But I think there are some positive changes that are being proposed. As you know, there's some conversation, I'm not privy to it, with Villers around air services and whether, air transport for patients down to Fort St. John and Dawson. There are some changes, again, they haven't been announced yet, I believe, that are afoot at BC Ambulance around changing up and making the ground ambulance more improved for the Northeast and Fort Nelson in particular. Friday, we met the new community paramedic in the community, which is a huge boon, I think, for Fort Nelson and area. So there are a number of things that are happening. As I mentioned before, the real-time video support, those sorts of things that I think they're incremental, but they get you toward the vision. And I think that's the piece is making sure that you still have a vision, around diagnostic imaging. But what does that look like? What does it look like 3 months from now, 6, 9, 12? And it might one day be a CT scanner, but it might not. So what's plan B, right? And maybe plan B is assisting and supporting people to be able to travel. But I guess the goal is not to travel, and I'm very sensitive to that. But I think it's figuring out what we can do right now that gets us toward that vision. But as you were saying, Mayor Fossey, it's also being realistic about not boiling the ocean, so to speak, right? So it's great to have 7 to 12 priorities as a vision, but working effectively on 7 to 12 priorities, you have to splice time in so many little bits that you may end up not being very effective on any of them. So I think there's an argument to be made, and certainly it's something I'm struggling with as we begin the work of pulling the strategy and implementation plan together, where the challenge to you as regional council is, what are maybe the top 1 or 2 things that you really need to hammer away on in the next year, that are going to make a big impact on the community. And what does that look like? And who do you need to talk to? Not tossing out the other 7 to 12 priorities at all. And there may be opportunities where you might be advocating for priorities 1 and 2, and then suddenly you hear that at the provincial level, number 4 is going to be, a top priority for the northeast part of the province. Well, obviously, you're going to hop on that bus and begin advocating for that. So it's a combination of being strategic, but also opportunistic. So as things come along, being able to grab those and bring them in and saying, yes, this aligns perfectly with our strategy, as well as, being able to continue to advocate on the other things that you're focusing as well.
Okay, thank you. Councillor Gerwing.
So just with respect to everything that has been said, the whole start of the project was around equitable access to healthcare services, and the priorities have come out of our residents' desire to have equitable access to healthcare services. So it makes me a little bit nervous when we're talking about, 1 or 2 priorities. I get the whole high concept as opposed to the individual pieces, but I would just encourage everybody to keep equitable access to healthcare services in the forefront of any plan that is being developed.
Councillor Roper.
And just one more comment just about the conversation is that we have to have the mindset that we can achieve these things that we need. We shouldn't be going into this thinking, well, we're not going to get this anyway, so let's go for this. We really need to put our efforts into believing that we are going to get somewhere with some of these things, and we need to as a community. It's so important. So I would just ask everybody to keep a very positive attitude and to go forth knowing that these things are achievable if we put enough work into it.
Well said.
Thank you. Is there any more comments from Mr. Blackie? Very well. We're going to give you back a half an hour of your day then, Mr. Blackie.
Works for me. Great. Well, thank you, Your Worship, and members of council. Always a delight, and staff. It's always a delight to be able to bring you a bit of an update on the project. It's an exciting project. I think there's a lot going on regionally and provincially that I think is really going to be helpful, and I think it'll move the chess pieces toward your vision of equitable access for sure to health services. So yeah, thank you very much. I'll let you carry on with your conversations. And we'll check in, I guess, formally in a month. But in the meantime, I'm hoping to, as I said, share our draft documents with you in the next couple of weeks. So yeah, have a great Monday.
Thank you.
Bye.
Very well. If there's nothing further, then I guess I will ask for an adjournment. Moved by Councillor Roper, seconded by Councillor Penny. All those in favor? Carried. Thank you. Well, I saw that and I was wondering, I saw it at the corner of the screen, then it left, and I thought, well, is he reaching for